Welcome back, everyone. This day has been truly amazing, and I hope that all of you have been able to enjoy each other's conversation, expertise, friendship, and collegiality. In our final panel of the day, we wanted to explore as a community concept of diversity, equity, and inclusion. As Dr. Wayne mentioned at the beginning of the day, the killing of George Floyd, Breonna Taylor, and numerous others, both named and unnamed, have raised very important dialogues about how we think about systemic racism and the culture of inclusivity within healthcare. As an educator, my personal journey exploring this within an educational and academic construct in medical education began when we decided to engage our students with the implicit association tests about 10 years ago. In asking our students to take these tests, we realized that we were unprepared for the ensuing backlash that followed. Students were not willing to acknowledge their own implicit biases. And perhaps more importantly, we had not properly worked with our faculty to help them model their awareness of implicit bias through authentic vulnerability. Medical education and healthcare education, broadly speaking, has missed the mark. In this recent piece by Lash Nolan, a current student at Harvard Medical School, she beautifully describes the homogeneity of the white male construct that is used to teach important concepts in medical education. And while physician education has been more critically examined, the same must be asked of all healthcare professions. How do we represent the diversity of human experience through the lens by which we are taught to work with others? For example, is an acupuncturist in training or a chiropractor in training taught to examine their biases and address systemic racism? In addition, we must critically examine our own workforce. As Evans and colleagues explore, how do we begin to think about the diversity of the workforce to serve the diversity of the population? And Dean Williams earlier today brought this exact concept up. Just look around in your own environments and institutions. Just look at where you trained or studied your healthcare discipline. How inclusive was that culture? And I do think we need to be honest here. As Dr. Vanessa Grubbs brilliantly writes, too often, academic medical institutions' idea of addressing institutional and systemic racism begins and ends with naming a titular diversity, equity, inclusion chief. Every so often, they tout their racial and ethnic diversity, not mentioning that it resides primarily in janitorial and food services. We have to engage in a space of deep listening. If we want real change, we must shift to a culture that allows open dialogue and continuous learning at all levels. As Dr. Yancey states, atonement matters, culture matters, evidence matters, and leadership deeply matters. And so we need a path forward as individuals, but also as organizations. This recent Lancet piece describes a 7-point approach. End avoidance and silence, target exclusivity, establish and uphold accountability, engage communities of color, treat failures in their processes as assets, address racial violence, and embrace and expect and embrace backlash. Today, we are fortunate to have eminent thought leaders to discuss these constructs and ideas and really describe how they have taken to action. Our keynote address will be given by Dr. Joe Betancourt. Dr. Betancourt is the Vice President and Chief Equity and Inclusion Officer of Massachusetts General Hospital, the founder, senior advisor, and faculty of the Disparity Solution Center at MGH, faculty at the Mong Institute, and an associate professor of medicine at Harvard Medical School. and he is a practicing internal medicine physician. He's a nationally and internationally recognized expert in health policy, healthcare disparities, diversity, and cross-cultural medicine, and has served on several Institute of Medicine committees, including those that produced the landmark reports, Unequal Treatment, and Increasing Diversity in the Healthcare Workforce. His talk will be followed by commentary from Dr. Nawal Noor. Dr. Noor is the newly appointed chair of the Department of Obstetrics and Gynecology at Brigham and Women's Hospital and the Kate Macy Ladd Professorship at Harvard Medical School. Prior to assuming her role as chair, she served as the Chief Diversity and Inclusion Officer for the faculty, trainees, and students at Brigham and Women's Hospital. She established the world-renowned African Women's Health Center, which provides appropriate holistic health and outreach programs to the African community in Boston. Following their presentations, we will have a live Q&A panel, which will feature two students, Tony Beal from the New England School of Acupuncture and Jalen Benson from Harvard Medical School, to discuss their perspective.